Never figured this out.
Hi, Alison.
Hello, everybody. Welcome. Hi, Gurpreet. I'm just going to do a short introduction. Welcome, everybody. Thank you for coming. This is Gurpreet Kaur, and she is a DSW placement student with us from CTS Career College, and she's going to speak to you today about invisible disabilities. So I'll give the floor to you, Gurpreet.
Hi, everyone. So my name is, as Alison introduced myself, so I am Gurpreet, and so I'm going to present invisible disabilities. So let's try to understand what the disability is. Could you please pull up the presentation so you can see it?
Sorry, Gurpreet, just one sec.
Yeah, no problem. Take your time.
So I'm not the host, so I can't pull it up.
Okay, that's fine. I can speak if everyone's fine with that.
If you just want to quickly send it to me, I can pull it up here, Allison.
Okay, so Michaela, is that you? Okay.
Yes.
I can. Yeah, so I will share it.
Perfect. Allison, if you have it there, I just made you the host, so you might be able to share it now. Oh, you made me the host? Yeah.
Connection? It's all good. We're good.
I also shared it with you, so if anything.
Perfect.
I need you to share it, Gurpreet, if you've got it there.
Yeah, I've just shared.
Allison, do you have it there?
Yep, just a sec.
Okay, perfect.
All right, I can send it one more time.
I'm just trying to find it here. Sorry.
It's okay, Alison. I sent you again, so you can maybe look.
Where did you send it, Gurpreet?
I just sent it to your email, so you can see it.
Where?
In the crown. Have you got it?
I just forwarded it to you there, Allison.
Okay, so I guess it's just PDF. Not a PowerPoint?
Yeah. Okay, do you want I can do
No,
that
it's all
too.
good.
I've just shared it, so maybe you can do it now.
Sorry, everyone.
Yeah.
So I can't share it. I'm not a host.
One second.
Hey. Okay, so I got it here.
Yeah, so and then yeah, and then the alternate, and then And then go to share screen.
Okay.
And then go to Facebook. And then go there. And share.
Okay.
And then resume.
All right, so let's try to understand what a disability is. So any condition that makes it challenging for a person to interact with the world around them is considered as disability. So for example, I have my spectacles on. So if I remove it, I can see around me. Like I can't able to, it is hard for me to interact with the world as I am unable to read right now. So this is my accommodation. And so this is my disability that I can't see people far from me. So disability can be physical and mental. Next is invisible disabilities. So disabilities that cannot be seen. It's an umbrella term that we use. The invisible disabilities. It's an umbrella term that we use for a whole like bunch of disabilities. It could be physical, it could be mental because it covers psychiatric disorders and it covers physical disabilities. So anything that limits our abilities to do something is considered to be a disability. And if it's hidden, so if I remove my spectacles, you don't know if I have a disability or if I don't have a disability. So it is only me that I know I have this disability. So it is invisible to others. So it is considered to be an invisible disability. So the challenges we face, the challenges that a person with an invisible disability can face are not knowing about the disability. So this is something I face because I have anxiety disorder. So at first when it started, I wasn't sure what's happening to me. I was having panic attacks and I wasn't sure. It was so scary and I wasn't sure what's happening to me. So something undiagnosed disabilities can be very scary and the person doesn't know what to do next and the person doesn't know his accommodations, what can help him because he's unsure of the disability he's having. So the next is lack of knowledge about the resources. So obviously, if the person is not sure of the disability, then how he gonna know about what accommodations or what resources could help him or her? Next is may feel misunderstood and ignored and or invalidated. So this is very common people can face when they don't know about their disability or it's undiagnosed. So yeah, so this is about it. And next is most common invisible disabilities. So the disabilities we are going to see in this life is psychiatric conditions like major depression, bipolar, and schizophrenia. I'm sorry. So anxiety disorders and post-traumatic stress disorders, that is PTSD, and ADHD, FASD. So these are some disabilities which are present from the birth and they are considered to be developmental disabilities. And next is epilepsy we are going to see, and we are going to know about a little about chronic fatigue syndrome, and we also going to see about the learning disabilities that people can have. Next is the prevalence. Prevalence is the how much people people out there have these disabilities. What's the ratio or what's the number? So according to the 2002 statistics, Canada survey, 3.8 million Canadians aged under 15 or older report that disability limits their daily activities. And 1 in 5 these people said they don't use an assistive device. So it's quite hard for them to interact with the world. So you can see there. In any given year, 20% of the Canadians will experience a mental health issue. And 1 in 10 Canadians has a learning disability. All this means there are a lot of out there who are struggling with the world, and that's been set up to non-disabled and people around us often don't get what we are struggling. And also, there are some psychiatric conditions we're going to see now. First is generalized anxiety disorder that I have. You can see, like I get panic. There's nothing to worry, but I panic. Like it's me. Like it's my disability that is disabling me from interacting with others because I can see like it makes some sense to me. It doesn't make sense to others, but it makes some sense to me because I have this issue. So this anxiety disorder, what is this? So first, it's a persistent excessive stress about money, health, family, work, or any other issue. So right now I'm presenting, I know there's nothing. We all know each other. We all make mistakes. Like there's nothing inside me knows everything, but outside me is reacting in this way. Shaky voice, shaky hands, like you mess up at everything. So yeah, this is it. And the symptoms it include is rapid heartbeat. I am having it. So second is trouble in concentrating and sleeping. Third is irritability or frustration. And fourth is sweaty palms, upset stomach, and shaking of the legs, numbness in the different parts of the body, muscle tension. And the treatment it can include is medication and therapies. So how we can support the person with the anxiety disorder is we're gonna see at a few points right there. So provide the validation to feelings. We often like ignore these feelings. Like we often say, "Oh, you worry about such a small thing. Like why? There's nothing to worry." But as I've said, it makes sense to them. This doesn't mean like it their anxiety or their fears like have to make sense for you, but it is something for them. Like they are dealing with it. So yeah, provide a validation. It's very important when someone is facing their fears. So you provide the validation. Okay, you have anxiety. It's okay. It's gonna like pass away. That's okay. You find this way. That's fine to this way because you have this fear. You try to overcome it. And then next is express your care and concern for them. You got like you can say to them in a soothing voice, it's okay, it's gonna like I care for you, I'm there for you. It happened with me. Just a quick reference, I fear into going waters, but I want to go, like I want to go for swimming, but I have this fear of going into water. But this summer, I mean, what happened, I went to the lake Nipissing and with my friend. So when I went into the water for first time ever, and I had the panic attack starting, and I was very like very panic attacks, and where you like where you find you're gonna die or something like that. It comes to my mind, and I'm gonna die here. Okay, this is it. So what happened? There was Peggy Sue, my friend. So she helped me through it. She said, "No, I'm there for you. There's nothing going to be wrong. You're gonna go like swimming, and you're gonna have fun. It's very fun. So we are just if anything happens, I'm there for you. I can help you." So that validates that someone is out there for me. So someone is trying to help me. She is there for me. If anything happens, if I'm gonna like drown or something, she's there for me. She's gonna pull out uh, like me from the water. So yeah, so express your care and your concerns for them. This really helps. Next is don't enable. What that means is do not limit them. Like if they for example, someone is fear from going to the grocery store, and you said, "Oh, it's okay, I can do it for you." Don't, like, just let them fear it. If they let them do it. If they have fear, it can they will find the ways to overcome it. They will find the ways to cope with it, because this is something like we have to do. We have to go. This is our necessity. Like if someone's going for shopping or something, this is their necessity to go out and shop. So I know it's pretty common that we say, "Oh, I can't see I loved one in the anxiety and facing it." So we often can suggest, "It's okay, I can do it for you. You don't have to do it." But by that, you are limiting them. You're limiting their needs, and you're telling them to stop. It's okay, I can do. So it's gonna get what will happen. It's gonna get piling up. It will grow up. Like if you say it's okay, you should go, and I am there for help you. If anything happens, I am there. So this is something you should do. Not like it's okay, I will do it for you. No, let them do, and just validate their feelings and tell them you are there. And next is don't force confrontation. So there are some things that they wanna avoid it, and this is like this is good to be avoid something like something that they don't want to do. There's something they don't want to do. risky out there and they don't want to try. They said, oh, I'm going to water, I don't want to do this. Then don't force them. Oh, I'm there, it's okay, go, let's go out. No, it's okay. If they feel in this way, then they don't want to go, it's okay. Then we're gonna see about depression. Depression is a complex mood disorder that affects a person's daily activities due to the loss of interest and intense sadness. um so symptoms for this is hopelessness, emptiness, angry outbursts are just over the small things, oversleep or no sleep, fatigue, and I'm sorry, just need some water. So oversleep, fatigue, are persistently tired, weight gain or weight loss. Weight gain and weight loss can happen due to excessive eating or no eating at all. So unable to think or behave, feeling of worthlessness, and recurrent suicidal thoughts or attempts. Treatment for the depression is include the antidepressant medications, anti-anxiety medications, antipsychotic medications, and some complementary physiotherapies are also out there to help the persons with the depression. And the tips for us to support them could be encourage the treatment to stick with it. It's quite hard for the person who is having depression to stick with the treatment because they can think, oh, I don't want to live. There's like uh, I don't see any meaning to my life, so I want to die. What's like? Why would I treat myself? Because I don't want to live. So this is very important for us to tell them you should stick with the treatment. So stay alert of the suicidal risk and call emergency on the suspicion. So if you find like the person is going to put their life on the risk, so you must be very alert on this topic, and you must call emergency line and be willing to listen. The person with the depression, if they want to let their thoughts out, and you must be there to listen them, non-judgmental listening. So next is offer help. Whenever they need help, you must be there. Give some positive feedback and reinforcement. This really helps. So if they do something good, if they show a good behavior, you must tell them, yes, you did a good job, and you're doing perfect. You're doing perfect in your life. So yeah, positive feedback does help. Help to create a positive and calm environment. Connect with the resources and encourage them to practice the spirituality through the meditation. Meditation also helps when a person has depression. Schizophrenia. Schizophrenia is a serious mental health disorder in which a person can interpret reality abnormally. This is like something I can feel it because the person who is having delusions or hallucinations, it's very a serious disorder, I would say, and it's very scary for them to deal with it because they are seeing the people, they're hearing the voices that are not there. It's quite scary. It's quite scary to feel. Symptoms include delusions, false thoughts, and hallucinations, hearing or seeing the things that are not out there, and disorganized speech, abnormal motor behaviors, and negative symptoms. Negative symptoms include those symptoms which are not show the positive behavior, the behavior we usually do. Treatments include requires a lifelong treatment. Antipsychotic medications and psychosocial therapies can help them to manage their conditions, and support that includes is encourage them to join the support group. If they talk about their problems, this can help them to overcome the fears of when they have this episode of schizophrenia. And next is encourage them for regular doctor visits and regular treatments. Avoid the power struggles with them. This is something very important because if you are doing a power struggle with them, they might think that you want to like harm them or something. You want to harm them in any way, so it might be dangerous for you and for them as well. During crisis, if a person has some schizophrenia episode, you must be very aware. Don't panic and don't overreact, and speak very softly and slowly. Do not try to threaten them in any way. So if the person has an episode, so don't try to threaten them. Oh, I'm gonna call 911. So the person might be very sensitive to it, and they can misperceive the situation. And yeah, so you must be very careful about that. Call 911 if the symptoms getting worse. So yeah, this is it about it. And next is post-traumatic stress disorder, mental health state that is caused due to terrifying incident either experiencing or witnessing. I am assuming some of you have watched a movie called Groundhog Day. That was something like a person stuck in a time loop. Like this is something very similar to that situation where person stuck in a time loop. Like they are reliving that moment again and again and again. For them, they are having like they are reliving it. They can experience those terrifying incidents or events. So the symptoms include recurrent flashbacks of the traumatic event and reliving the event over and over. And next is trouble in sleeping due to nightmares. And the last one is severe emotional distress. Treatment include is medications are available as antidepressant and anti-anxiety. Paracetamol is one of the medication that can be very helpful. And therapies include cognitive therapy, exposure therapy, and EDMR, EMDR. I'm sorry. So how to assess how we can assist them is know about the PTSD. So what is the PTSD? PTSD is very important to know about what are the symptoms and how we can help them. Be active and a non-judgmental listener. So you don't have to judge while they tell their story or terrifying incident. Just listen to them. Be sensitive to the emotions and ask if they need any help or if they want to share something. And next is obsessive compulsive disorder. Is it practiced by repetitive unwanted thoughts and irrational excessive urges to do certain actions. So just one thing I want to mention. First, you have to know about the cycle of the OCD. If you want to help someone, you just have to know about the cycle. So the cycle proceeds the proceeds in the way. First, obsessions. So person has some willingness to do something. And then compulsions. They repeat it. They do it in order to calm their anxiety. So what happens when the person have reoccurring impulses to do something? It causes anxiety to do them. So when they do it, when they repeat something, and this calms down their anxiety. So this is why obsessive compulsive disorder. We have anxiety, so it's important to if they are having anxiety or OCD, so it's important them to cope with the anxiety when they have these obsessions. So they have to just stop the cycle to break the cycle. So when they have the obsession, they don't need to do the compulsion. So this way we can stop the cycle and we can deal with the obsessive compulsive disorder. And treatments include SSRI, selective serotonin reuptake inhibitor. These are the drug class which can help with the OCD. And therapies are also helpful, such as cognitive behavioral therapy and exposure response therapy. I'm going to talk about the exposure response therapy one more time. Exposure response therapy is nothing but exposure to the fears or exposure to like if the person has some anxiety going out shopping or to the grocery store. So if they are having the anxiety at that moment, like in the store or somewhere else, so they just need to know the techniques like box breathing, like anything, breathing out, breathing in. So they can use that to calm themselves down. This is called exposure therapy. You have the anxiety, you're applying some techniques to calm yourself down. So this is called exposure response therapy. It is helpful, I guess. So how to assist, how we can assist them is try to maintain the normal routines and identify the triggers and avoid them. So if they are worrying about contamination or contaminating their hands, so those are the triggers, and we can help them to avoid those triggers. Help them to cope with stress. As I mentioned, to break the cycles, we must tell them to cope with their stress when they have the obsessions and when they have the thoughts of repeating the things. And the next thing is common phobias. So phobias are the other form of anxiety. These could be the weird phobias. So we must understand. Yeah. So some phobias, I would say, is agoraphobia. Agoraphobia is the open spaces. So we can say, oh, why you are worrying about the open space? It's just nothing's going to happen. But for them, something is wrong with, about the mental health situation. So we must understand that. Acrophobia is fear of height. Claustrophobia is enclosed spaces. So these are pretty common phobias that we can see. But people are like face many phobias. There are many phobias. While I was doing this presentation, I got to know there are some weird phobias as well, like fear of spiders, fear of uh, night and darkness. I've mentioned this. Fear of darkness is eclophobia, and social phobia, where they are fear of going to the social events. Um, Treatments can include the beta blockers and benzodiazepines. Again, these are the drug classes that can help them, and also together with the therapies can very helpful. How we can support them is take the phobia seriously and take their perspective. And I'm again and again mentioning that we have to look at from their perspective rather than what we see. Try to calm them down by reassuring them. There are sorry, try to calm them down by reassuring them you are there for any kind of assistance. So any help they need, you are there for them. Ask what help, what will help them. So you can ask just a minute there how to assist them, and encourage them to breathe in, breathe out. Like you can tell them the techniques, like box breathing. I think box breathing is one of the best techniques. It really helped me. So box breathing is another way, and breathe out, breathe in, meditation. These are the techniques, some techniques you can tell them to cope with the stress. Next is balancing problems. People can have balancing problems due to several reasons, because of something wrong with the inside ear. So vertigo is the most common balancing problem we can see. Sensation of the feeling of the balance. It's a one definition we can give. There can be the different causes, and symptoms include spinning, tilting, and swaying, unbalanced pulled into the one direction. And treatments, how to assist them. So give them a helping hand. Make sure they have everything nearby while they are resting, such as water, their medication. So when they are falling asleep or they're sleeping, and when they get up, so it might be a trigger, or might be a trigger to the vertigo. So you want to make sure that they have everything around them. And last one is assist them in performing the exercise to relieve the vertigo. There's this exercise called Apley maneuver. It's very helpful. So next is I also included a video over it. Apley maneuver. It's a series of movements that especially a professional could carry out the procedure. So it's really helpful to relieve the symptoms of vertigo. So next is learning disabilities we're going to see. I don't think so we can start this video. So I'm going to skip on learning disabilities. So learning disabilities the person can have is so first we look at the definition of the learning disabilities. Alteration brain functioning in the manner which affects one or more cognitive processes related to the learning. These processing problems can interfere with the learning basic skills such as reading, writing, or doing math. So there are different type of learning disabilities. Some of them I mentioned. Dyscalculia is a specific learning disability that affects the person's ability to understand the numbers and the math facts. Next is dysgraphia, a specific learning disability that affects a person's handwriting and fine motor skills. Dyslexia is another disability that affects the reading skills and language-based processing skills. Nonverbal learning disability, when a person is unable to unable to interpret the non-verbal cues, like the non-verbal cues we often make with our face. So the person might not able to get those. Poor coordination is another symptom of the non-verbal learning disability. And next is oral written language disorder, specific reading comprehension deficit. Learning disabilities that affect an individual's understanding what they read or spoken language. So the ability to express oneself, oral language may be impacted. So next, we are going to see how we can help them. Be patient with the person who is learning disability. It might be like pretty common that we don't know about the other's disability with reading skills or with writing skills. So we might get impatient when they are doing something, when they're performing the act. So be patient, and ask them what kind of help they need. Provide accommodations they need. For example, one of the accommodations in this case could be taking some extra time to do things. So next is setting up the routine, using the simple communication, and next is using the pictures and calendars, charts, and simple illustrations. So I have this a drawing. I hope everyone can see it. So this is for the morning and this is for evening. So person with this disability can help from these. So if the person is having some trouble with let's say you are making them a chart to tell them when to take their medications. So if they're having trouble with reading stuff a lot, so you can use this. You can make a sun and you can make stars, like take this in evening, take this in morning. So you can use that. So this I make. All right. So having the time to understand. So give them time to understand. Give them accommodations, whatever they need. Make changes one at a time. It's hard. Sometimes it's hard to follow the changes to make. It's hard for me to follow some changes if someone makes it. So one change at a time. Provide any assistance they need, such as reading. So if next is developmental disability. First, we're gonna look at the autism. Autism is an ESD, refers to the broad range of conditions characterized by the challenges with the social skills, repetitive behaviors, speech, or nonverbal communication. It can vary from mild to severe. So this is a broad range. This is autism is an umbrella term, I would say again. So umbrella term is when lots of ones are it can have the mild disabilities. It can affect your like severe disability. Person can have severe disability in autism. So most common symptoms that we can see is avoidance of the eye contact and the poor eye contact. Repeating the words and the phrases. Social withdrawal as it affects the social ability, with interacting the other world around them. This is then again a symptom, social withdrawal. Unusual reactions in the social settings, or using the odd words or the phrases, lacking in understanding the social cues, hyperactivity, impulsivity, short span and attention span, sensitivity towards the sound, smells, and lights. How we can support them? Be consistent and reward the good behaviors. Again, positive reinforcement really helps. Pay attention to the safety, as they are not aware of the social cues or social the key things around them. So it's our responsibility to make sure they are safe and make their safety. And understand the understand their nonverbal cues. So if they are having challenging behaviors, like if they're crying or if they're making noises, so it's our responsibility to know what is the reason behind showing those challenging behaviors. So next is give them an appropriate behavior. So this is again related to the challenging behavior. So if they're crying and they want food, so it's our responsibility. We know that so if they are crying, they need this, they might need this. So we should get them an appropriate behavior. If we can give them accommodations. We can give them a paper or pen, like it could be anything. Giving them appropriate behavior means giving them a right way to say things, to communicate with us. So yes, so this is it. And the next is avoid the triggers and causes that causes sensitivity. So as I've mentioned before just now, that sensitivity towards light, sensitivity towards sound. So this can happen. So you should be aware of this thing. And then the sense related conditions. Sense means touch related conditions. So the very first touch or sense means we have the five senses. So any disability regarding that, we are going to see that. First is vision problems. So any disturbances in, sorry, I've written citation. So any conditions that affects our vision problems is considered to be our vision problem. So interferes with the normal sight. Double vision or diplopia, seeing the objects instead of one. Next is partial or total blindness. Refers to when a person can see some light or no light. And colored blindness is when a person is unable to distinguish between different colors. And next is blurred vision. And due to changing the eyesight, or like it could happen with me as well, because I have the spectacles, and if my number change, like from let's say +3 to +4, so I face this blurred vision. Halos is appearing of the circles of light around the object. This can be a sign of multiple or the different eye condition that an eye doctor needs to evaluate. Pain is another problem in vision. Next is how to assist with them. Approach, ask, assist. It's a key assistance that we need to perform. So if you have a client with a vision problem, so first you need to approach them, and then can introduce yourself, then ask what assistance they need, and you can do that. So when assisting, call them by their name so they don't feel excluded from the conversation. So you must try to say their name. When you enter in the room, let the person know first that you are approaching them. So as they cannot see, you just have to like constantly talking to them, and feel like you are there for them. If you are going away from them, let them know that, so they are not talking to in the air, or it's awkward for them as well, and for you as well. So in the dangerous situations, they stop instead, rather than saying look out. If you say look out, okay, the person is going to, okay, look at what, like, so use the word stop. So stop means, okay, don't move further. This can help in the furniture without telling the person, because they have their own mindset that these things are organized in this way. So don't try to move them. Be specific while giving that direction. Do not say look there, look here, or words like that, or try to avoid them. Be specific in the directions. Go straight, and to your right, to your left, could be some words while giving the directions. Describe any obstacles coming on the way. And next, the last one is, when assisting with anything, keep telling them what's going on, so they feel they are included in the conversation. Next is hearing impairment. Hearing loss is when you are unable to partially or completely hear sound in one or both from both ears. There are mainly there are three causes: conductive hearing loss, and sensory neural hearing loss, and mixed hearing loss. So the first one is conductive hearing loss, when you are unable to, there's some impaction in the middle ear that can cause this problem. And sensory neural sound is maybe present from the birth, and mixed hearing loss is it's a like mixed of both of the causes. So this is that's why this is called mixed hearing loss. Next is how to assist. So they can see your face. They can well, this is a myth that they are able to read your lips, but yeah, it's helpful them in the way they can know your nonverbal cues. So yeah, it's important to make sure you're in a perfect light and directly speaking to them. Speak slow and clear normally. Do not shout or get louder. say their name and wave your hand in the beginning of the conversation to get their attention. Avoid speaking fast and get feedback from them just to make sure that they are following what you are saying. Be aware of the possible distortions of sounds for hearing impaired person. They may hear your voice, but still may have difficulty in understanding some words. So in that case, I would suggest you try to use the different words. So if they are unable to get those words, so you can try some. That's I've just mentioned that if they are not getting something, so you can try the different words. Make sure you don't have any disturbances going at the background. If you are giving a specific information, like such as time, place, or phone number to someone who has this problem, have them repeat the specifics back to you. So they can repeat what date and what time they have listened, they have predicted. So you can tell them to repeat. So you make sure that they followed what you said. Next is hypothesia. Hypothesia is a sense touch related problem. So medical term for the partial or total loss of a sensation in your part of your body. So the person might not feel pain, temperature, vibrations, touch. So as this is related with the touch, so the person might have some problems feeling pain, temperature, vibration. So how we can help them as they are unable to feel the sensation. So before serving the hot meals or the cold drinks, so you want to make sure they are at perfect temperature and check the room temperatures. They must be set to between 19 to 20 degrees Celsius, as these are the ideal temperatures. You want to make sure about the room temperatures as well. Next thing, very important, if while you are giving them personal care, maybe you're giving them bath or something. So check out for any wounds or bed sores they have. So because their body is their skin is desensitized due to this condition. So make sure that they don't have any sores or wounds around them. So if you find any, just try to treat them. Next is chronic fatigue syndrome, complicated disorder characterized by extreme fatigue that lasts for at least 6 months, and they can be fully explained by any underlying they can be fully explained by some underlying medical condition. So symptoms can include fatigue, problems with the memory and concentration, sore throat, headaches, enlarged lymph nodes in your in necks and armpit. So unexplained muscle or joint pain, dizziness that worsens with the moving from lying down to sitting or standing. Unrefreshing sleep. So unrefreshing sleep means the person wakes up and doesn't feel refreshed. Extreme exhaustion after physical and mental exercise. Treatments that can help, it could be the medications or the some therapies, and how we can support them. So there are some points. Help them to manage their stress. Stress can be a cause of fatigue. Encourage them to eat healthy. Eating healthy is really, really helpful. So eating healthy includes avoiding junks and having the proper diet with the proper nutrients in it. Contact with the primary caregiver to find out the underlying causes or the further treatment. So they could be, as I mentioned, they could be the underlying causes that usually this condition appears due to that. So you want to try to find out that and treat that underlying condition. And next is epilepsy, a central nervous system neurological disorder in which the brain activity becomes abnormal, causing the seizures or the periods of unusual behavior, sensations, or sometimes loss of awareness. Symptoms that include temporary confusion, staring spell, and uncontrolled jerking movements of the arms and the legs, loss of the consciousness or loss of consciousness and awareness, psychic symptoms such as fear, anxiety, or deja vu. Deja vu is another form of epilepsy. I got to know it when I was doing this presentation. So treatments that include could be a surgery, and there could be some therapies out there to help them. So how we can support them includes carefully roll the person up when they have, and during that episode, we are going to look at those tips when we can help those persons when they have the epilepsy episode. So carefully roll the person onto one side, place something soft under his or her head, loosen, tighten a neck wear. Do not try to put your fingers anything else in the person's mouth. No one has ever swallowed his or her tongue during a seizure. I got to know this myth during I was doing this presentation. So I learned a lot. So this is something people believe, that people swallow their tongue. This is like, I don't think this is physically possible. So yeah, this is again a myth. So if you are trying to put something under their tongue or under their teeth, you might get hurt. So I would try to not to do that. So do not try to restrain someone during a seizure. And next is, if the person is moving, clear away the dangerous object. Stay with the person until the medical panel arrives, and then observe the person closely so that you can provide the details what happened. Time the seizure, how much time what was the duration for this episode. You can try to note that down. And next is be calm during the seizure. So you want to make sure you are calm down and you are relaxed in order to help them. Next, some takeaway notes: empathy versus sympathy. This is my favorite topic, empathy versus sympathy. These can be the minor, like very minor, I would say some differences, but it really affects the person who you are helping or you're dealing with. So empathy, what is that? Sympathy is feeling for the person, empathy is feeling with the person. So you wanna take their perspective, you wanna feel with them what they are feeling. So in that way, you wanna help them, because sympathy is something for the people, and you don't wanna do that. Second is, don't judge a book by its cover. We often do that. I do that, including myself. Like I always, if you're driving or if you're doing anything, we always judge others. But this is something we should avoid. We really should avoid this. We are not here to judge, but we are here to help. So as a DSW or any, I would say any caregiver, or when we are in this field, we should try to judge. We should avoid to judge, and we should try to help. And this is it. This is it. All right, this is all I have to say on this. Any questions, you can let me know. I tried to do my best. Everyone is gone. I feel like I was talking to them myself. Yeah.
Thank you, Gurpreet. That was awesome.
Okay.
Yeah.
I'm sorry. Thank you so much.
I think we all learned a lot about invisible disabilities today, and especially how to help. So that's wonderful. I didn't know a lot of that stuff, and I'll definitely use it.
And yeah, I was very like I know I was kind of fussy about this. Like I was so confused and I was panicking. I'm so sorry for that, but I tried to do my best.
You did a great job. Thank you so much.
Somebody made a comment about
Thank you.
Somebody made a comment, but about, oh, here we go. Something that I thought would be discussed but seems to have been missed, or I misunderstood meaning of invisible disabilities, is that of fibromyalgia.
that would be another good topic.
Yeah, so maybe next time there's
Okay.
including fibromyalgia with chronic fatigue syndrome.
Okay, so could you include that with the 20? Yeah, sure, I can. So so do you want me to include it?
We can post some resources on that, maybe on
In this
our social media or something like that.
Right. Okay.
Yeah, thank you very much, Gurpreet. That was great. There's some comments here. Thank you.
No problem.
Great
No problem.
talk, great presentation. Yeah. So Yeah, thank you very much. And if anyone has any, oh, Mario, I'm the founder of Fibromyalgia North Bay. Awesome. Yes, we can definitely post some
Right.
resources about fibromyalgia. That would be, yeah, I think there's so many invisible disabilities. It's hard to include them all for sure, but I think that was a really great presentation, Gurpreet. So thank you. And we will post some resources on
Thank you.
fibromyalgia and other invisible disabilities. But yeah, other than that, thank you everyone for coming. Thank you, Gurpreet. And if you have any questions, you can always email or call the office here. But yeah, other than that, have a good day, everyone.
Thank you. You as well.